of the 3 weeks is for us to review where we are and see if we've had an impact jointly on the slope of that curve. But I think to make it clear to the public, if we are successful, we will have squashed the top of that curve, which is brilliant. But we must not then suddenly revert to our normal way of living. That would be quite dangerous. If we stop then, all of our efforts will be wasted and we could potentially see a second peak. So over time, probably over the next 6 months, we will have a 3-week review. We will see where we're going. We need to keep that lid on, and then gradually we will be able to hopefully adjust some of the social distancing measures and gradually get us all back to normal. So I think 3 weeks for review, 2 or 3 months to see whether we've really squashed it, but about 3 to 6 months ideally, and lots of uncertainty in that, but then to see at which point we can actually get back to normal. And it is plausible that it could go further than that. We just need to wait to see how successful we've been. And of course the bottom line is, as we always say, keep practicing good social distancing, because we will manage it quicker and better between us.
I've put in place, in all parts of the country, procedures to ensure that everywhere can be ready to move forward together. All parts of the country are now on an emergency footing. This is an unprecedented step in peacetime. We haven't done anything like this since the Second World War. This means that we're establishing strategic coordination centres across the whole country. Each centre is led by Gold Commanders. We're bringing together senior members of the emergency services, the police, the fire service, the ambulance service, with local authorities and the NHS to lead communities through this challenging period. We simply cannot and should not ask people to be on the front line without the right protective equipment. We have a clear plan to ensure that those serving this country at this time have the right equipment. We've established the National Supply Distribution Response Team, and they're supported now by members of the Armed Forces and other emergency services who are working around the clock to deliver the equipment to the people who need it most. To NHS and social care workers, all those who rely on this equipment, and to their families and loved ones watching this afternoon, we understand, and we will not stop until we have got you the equipment that you need.